Hi everybody, we're here today for a special Socrates Lunch and Learn webinar on the new COVID vaccinations functionality that is being added to your Socrates system. We've done this webinar as a standalone one and it's just myself and Louise on it because of time restrictions, and we just wanted to get you an overview of what's coming into your Socrates system as soon as possible. So, sorry, my name is Donal O'Neill. I'm the head of marketing for Clonwilliam Health, and I have Louise Murray, our support team lead for Socrates, with me today. Louise is going to give a quick run through of the functionality, which will hopefully get you up to speed and show you everything you need to know to start using Socrates to administrate the vaccinations that you're giving to your patients. So look, without further ado, I'm just going to hand the controls over to Louise, and she's going to run through the update that is coming to your Socrates system.
Thanks. Can you see my screen?
I can indeed, yeah.
Brilliant. Okay, so before I actually start on how it works, I just want to point out a couple of things before I start. So today is the 5th of February 2021. So this is based on all the information that we have as of this moment, but things may change. But the concept, I think, should work no matter what changes are made. So, and also I am using a test environment, so I'm not using a live health link information, so I can do this sort of thing. So I just want to flag that you please don't actually try and send vaccines via this, because it will actually just cause problems, because it'll actually record on the HSE side that vaccines have been given, and it's just to make things clean and proper. Please don't send off any vaccines unless you are actually given the vaccine. For this to work, when a patient comes in, you'll need to do a couple of things. You'll have to just make sure the patient has their PPSN with them. They have either a mobile number or an email for themselves for tracking purposes. You will need to have a health link cert on the machines that you are going to be doing the vaccines on and submitting them from. And you also need to take record of your PCRS contract number. So the first time you do one for a particular, on behalf of one of the doctors, you will have to just note that, because it's going to submit with that. Okay, so first things first, I am going to show you, you're going to get your batches in first. So I'll show you that. So we'll go into my control panel, admin console, and then immunizations. So in my particular Socrates, I have, and so will you will have all shots for all vaccines. So you do not add them yourself. They will come with the build. These are special types of shots. They are shots that will be linked with the HSE. So they're special types of shot basically. So you can't create them yourself. You have to use these ones. So we have the AstraZeneca shot, 2 shots of those, the Moderna, 2 shots, Pfizer, 2 shots. So as it stands at the moment, we have been given information that the Moderna or the Pfizer ones are going to be the ones that are going to be given first of all. So the AstraZeneca will not be included as of this moment. So you're going to get the Pfizer shot 1. So let's just say you've gotten in a batch of that. When we look at this, it's all grayed out. You can't modify this. This is the information. It's a special type of shot, and as I was saying, it's COVID-19 Pfizer. So it's a special one that's linked with the submission. So from here down at the bottom, I have filled in a batch number for Pfizer, and I have just filled it in, and I've put in the information on it, and I have linked it with shot 2. So I'm just going to show you the Moderna one. So underneath here, the exact same concept. I have name, type, dose, all the doses, etc. for all shots will be what is needed. So for this example, I'm going to do the Moderna batch number. So Moderna, I'm going to just make one up. And I'm going to put in the expiry date. Batch count, so whatever amount you get in, and straight away you're going to have the same amount remaining. Then we're going to search for the drug. And we just select the correct one. the Moderna version, and we click on save, and if you want, you can go complete batch when 0 remaining. Some people don't like to do that, but you can if you would like. So it'll inactivate once you've given all the shots. So then you need to do the same similar concept under the Moderna shot 2. We need to put the batch number underneath this one too. So you can just type out some of it and click on tab, and it will automatically come in now. That's actually a new feature in general in the immunization section. So what that's actually after doing is it knows that that batch number was typed out before. So it knows to link it with that. So otherwise what you could do is just do what I'm doing here, which is click on the button with the 3 dots to the right of batch number, type out the batch number and click search, and then it will appear down at the bottom.
Right.
And then we click on save. So now we have all of the shots and batches in. So now I'm going to show you how to add it into a particular patient's chart. So consultation, I have set up some fake patients. So Mary vaccine. So we go into her chart and we begin consultation like normal and click on save. So under the immunization section, you have a new button here on the left-hand side, and it's called Add e-Vaccine Schedule. So if I click on this, it will pop up, and the only options that you see in here are the electronic vaccines. So these are the ones that you will have, which is the 3. So whatever ones that you're given in your surgery, you are going to select them from the drop down of what schedule you're given. And then underneath this, you have a consent window and some mandatory fields that you need to fill in before you can administer the shot. So you will have your own checklist of questions that you probably need to ask them. Are they eligible? For example, are they over 85 or whatever the age bracket is that you're dealing with at that time? Patient is eligible. Patient has consented. Your options are yes, no, or best interest. The allocation group, from in here, it's going to default to IE allocation group based on patient's age, but it could be one of the other above options. So this is the batch that we're dealing with for the first administration for people. So if it then changes, then you can choose whichever option it is. So I am currently logged on as Dr. Joe Blogs. And so it's defaulting to me because I'm logged on as myself, and I am actually the person who's going to be submitting it in under. If I was a nurse, what I would have to do is I would just have to select the doctor from the dropdown. Underneath this is your PCRS contract. So this particular doctor, so a lot of doctors have a GMS panel, and that is your contract number. So this is automatically coming in here because this doctor actually has a GMS number and it's brought it in here. If you are a doctor that doesn't have a GMS list, you still have a contract with the PCRS. So you have to manually fill in that number in there the first time you do it. So you'll find out your PCRS contract number, type it in there, and then you won't need to fill it in again. Underneath this, it's automatically selected the patient county because it was in my address. It shows my ethnicity as white Irish, can be changed to something else. And as I was saying, you need to have either a mobile number or an email address filled in. If you don't have an Irish mobile number, this has been incorporated to make sure that you can actually use the area code in here. So for my example, I am going to be just putting in, if I did have a mobile number in my chart, it would have automatically come in from there. So if I don't want to be tracked using my mobile number, I would just fill in the email address. It has automatically brought in the patient's PPSN. So that's coming there. If not, you could just type it out, and you just type it out. And once this is all filled in and you click on next and we submit it, all of this stuff, the only thing that will get saved back in the chart, if there was none, is the PPSN. The mobile number or email address does not get included in there. So that's the first screen. So you can't go any further until you fill all this in. So if it's the case that the person does not have a PPSN, you would choose in the drop-down unknown. And if you choose unknown, it basically says, I wish to proceed without electronic reimbursement. In here, this person has a PPSN. So yeah, it's important that you have PPSNs for the patients. So I'm going to go to the next screen, click next. And from here, it's the exact same window that you would normally see when you give a normal shot. So from here, I have the name of the shot, the date due, it's given by Dr. Joe Bloggs, date given today, batch number, expiry date. It's brought in all that from the batch information I filled in. And then underneath that, I go on site and I just choose where I've given it and I click on save. And as soon as I click on save, what's going to happen is it's going to submit it straight to via HealthLink. It's gone off. Now, if it's the case that you have never done anything HealthLink related through the system, so if you've been doing, for example, e-referrals or submitting cycle of care visits or CDM visits or downloading bloods, you will more than likely have your HealthLink cert installed on your machine, and you will also have at least once put in your HealthLink details. If it doesn't, this is the window that would have come up there for you. It is not that one. I don't know where it is. I accidentally closed out of it. So the window above here, you will actually see you fill in your HealthLink username, password, and PIN in there, and you click on save. So from there, I go to the next part of it is how do you actually administer it if the person that's coming to you has actually has been given the vaccine from another location. So I'm going to go into a different patient's chart. I'm going to choose vaccine Roy. And I'm going to go begin consultation, and I'm going to click on save. So from here, I go to the immunization section again, and I'm going to go add e-vaccine like normal, and I'm going to choose the Pfizer one again, and I'm going to fill in the exact same information. So eligible, consented, this is the right doctor that I'm going to use. If it's not, I choose another one. And if that number wasn't there, I would have typed it in. It's automatically brought in Sligo because that's in my address. And I have to put in a mobile number. And then underneath that, my email address. And then here, it's going administered elsewhere. So if I tick on that, it's basically saying that it's been administered at a different location. So you can then choose it was given whatever date it was actually given. So let's just say, for argument's sake, it was the 1st of the 1st, 2021. And then you can click on save. So now you can see that it was given at a different location. So now you can then go and give the second shot. So you basically administer it the same way as a normal shot. You have to fill this in again, and then you just administer it the same way that I showed in the last one. If, for example, it fails to send, you can get them resubmitted. I'll show you that now. So my control panel, claim tracking. So from here, you have the immunizations tracker. You've been in here probably for other reasons, but for the COVID vaccine, you're going to go in here and look under the immunizations ones. So this is what you would normally see for your like flu vaccines, your childhood vaccines, etc. You see them all in here still, but we have the electronic ones. You can see the little symbol to the left. That means it's an electronic result. So this person, these ones were done, so there's one here that says not sent, and the reason was earlier on I did have a HealthLink cert on this machine, so I got to administer this thing, but I haven't submitted it to say that I actually have given the shot. So now I fixed my HealthLink cert, and I will be able to resubmit it by either one, going back into the chart and submitting it, or I can highlight it here and click on submit, and it will go off. This is looking at the not sent list. So this is the sent list. There is Mary vaccine. Here is the received ones. Joe Vaccine got one done, and we've got a response back from the got a response back about it saying, yeah, we've received it. And there's a message ID on there, and this is the information here. And then any rejected ones, you see them in here. So a reason that it might be rejected is maybe the PPSN might have been wrong, or maybe the contract number that you have filled in is not the right one, and it says we don't have a record of that contract number. If that is the case, you can fix it and resubmit it. But for the not sent ones, I'm just going to show you what I'm going to do here is I can highlight Jane Vaccine, and I can just either double click on it and click save and it will go, or I can highlight it and go submit and it will submit off. So this is the claim tracker. You're going to be looking in here a good bit just to make sure that they're actually sending off for you. So the results that are coming back, so when you submit them off, they're going through HealthLink and they're going to the relevant areas that it needs to go to, and then you will get a response back. And the responses are coming back through HealthLink as well. So they will be downloaded at the same time as you downloading your bloods. So in under communication, lab messaging, whoever downloads the bloods, you mightn't even be the one that's doing it. Whoever does it, it will download this at the same time. So communication, lab messaging, and then I'm going to click on download electronic messages, and now it's downloading the responses that I have. So I just want to tidy this up. So I'm going to close all the windows. I'm going to go back into my control panel, claim tracking. So the one that I had there a moment ago was not sent. Is now gone into the sent list and received. I have now received a response back for Mary Vaccine, and I have nothing rejected. So that's pretty much on that side of things. But there's just, if people are obviously trying to gather all the information that they need on who needs to come in for their vaccines. So from that, you can run the following reports. There's a report for full patient listing. So then that way you can return people that have between a certain age that needs to come in. So when you run the full patient listing report, you can choose ages between a certain age group and return those people. You also have under the appointments report, you have patient attendance between dates. Sorry, first one, second one there. Patient attendance between dates. And you can then run all patients that have come in the certain period of time, and you can go through age brackets. So some people wanted to return people that have come in recent years. So you can run that report. And then you also have people are trying to find out, because as I've said, you need to have the patient's PPSN to be able to submit it electronically. So people are trying to gather the information of who doesn't have a PPSN. So there's a report in here called Incomplete Patient Records. So I'll just search for it up here, incomplete. Incomplete patient records, and when you launch this report, it will allow you to choose who has no PPSN. So if I click on that and say, okay, I have hardly any patients in my example, so it's not going to return much, but it will return everybody that doesn't have a PPSN, and then that way you can follow up with them. There's also, you would use this for sending off the text messages. So in under communication, SMS messaging, there is the bulk SMS. So you'll be able to load in a group of patients. So to run a full patient listing of people that are of a certain age, and you can send them off a text from here. And there's a new report in here, so you'll be needing this after you start giving the shots. So you want to return people to come in and get their second shot. So what you'll do there is you'll go low group, and it's in under immunizations, and it's the report overdue and not given shot X.
Okay.
So that way you'll be able to return who needs to come in for their second shot. So we need to find out who needs to come in for their second shot of Pfizer, and you can then choose between whatever date, and then they will return and you can send those people a text. One other thing to note, you need to have your PPSN, which is, but when you do your PCRS import, people mightn't realize that that also includes the patient's PPSN. So if you update your GMS patients on a regular basis, you will have the PPSNs also included in that. So if you don't do the PCRS import, which is basically downloading a file from the PCRS, which includes all the doctor's valid GMS patients that particular month. When you import that into the system, it will update all of your patients to say, this is my GMS number, these ones have expired, these ones are new ones. It will also include the PPSN. So if you don't do that, it would be a good idea to start. That is pretty much it.
Okay, that was great, Louise. Look, that was really comprehensive and a really good overview. And I think it kind of shows that you know, we've tried to automate Socrates as much as we can to sort of ease the administration burden of this process. And look, I suppose the main thing is that we're here to help. And to that end, we'll also be adding user guides into our resources section on the Socrates website. So that's socrates.ie/resources for that. There'll be a user guide up there, and you can access that from the Socrates home screen. This webinar will be available on YouTube, and you know, you can share it with colleagues, get it out there, and also accessible from the Socrates home screen as shown by Louise as I'm talking about it. I suppose the only other thing to mention is that in there as well, there's a link to our video consultation software. And look, this might just be helpful to you guys if you are trying to keep the practice for solely for administering vaccinations. You may want to see other patients by video consultation. And look, we have that software there to help you as well. So if you want to learn more about that, just click on the third link there on your home screen as well, and we can definitely help you out. It might just be a way of kind of helping save your practice just for vaccination or whatever works best for you. But look, I think that was a great overview by Louise, and look, we'll be in touch with more information and more helpful guides as we do them. Thanks a million, Louise, and thanks to everybody for watching.
Bye.